Hello, he is Makan from Turkmenistan, and he was suffering from the avascular necrosis of the femoral head of both the hips. He was having more symptoms on the left side, and after the COVID pandemic, we are seeing a lot of patients where the head of the femur, which is part of the hip joint ball, is getting the avascular because of the decreased blood supply in that area. Now we have devised a special technique to treat these patients because they are not the patients who are having a repeated attack of the avascularity or the blood supply loss, because they had one episode of COVID and now they are not having any of the symptoms. So we have designed a special technique for these patients who suffer from the avascular necrosis because of COVID, because a single episode of avascularity is not a repeated episode for these patients. Like a patient with sickle cell, they have repeated episodes of the avascularity of the femoral head, but they have only one episode of the COVID. So what we do is, we suppose it's a femoral head, this part of the bone is dead. So what we do, we reach here through a tunnel, and in that tunnel we preserve the bone which is there. So we take that bone out, those cylinders, they help us in grafting this dead area of the bone. This dead bone we remove from there, and this graft which we had taken from the tunnel, we put that at the dead area. So it's practically your own bone which you are using to graft the dead bone. That's the best you can do for these patients, because the avascular bone you need to remove, and if you can graft that from the patient's own bone, that's the best chance of healing. And you can see the recovery is so fast that patient can do all movements. You can do this movement. And today is the 2 weeks post-op. You can do all the range like this. And if we do both the hips, then we have to put the patient on wheelchair for 6 weeks, because we want that bone to heal in the dead bone so that the head doesn't collapse, because once the head collapses, then the patient requires a hip replacement. Good technique, you have seen almost 100% recovery till now, because not a single patient has come back with pain.